Hi everybody, welcome back to UWorld's Next Gen Nclex review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have everyone back with us today. Today we are going to be doing another question drill set, but as always, let us know where you guys are coming from. Let us know when you're taking your Nclex or if you've passed it. I'll explain a little bit more about what we'll be doing today, but we have 10 question sets that we're 10 questions that we're gonna go through. We're focused on GI conditions, but we're going to have kind of a quick cadence to these. So I will read them. I will give y'all 30 seconds to answer, and then we'll walk through why the correct answer is right. So, as always, we encourage you guys to ask questions. We have our content experts moderating the chat. And I guess we're probably good to get started. And a quick shout out to our friends on TikTok. Make sure you guys share this session. The more the merrier. We want to help as many nursing students as possible. So with that being said, let's go ahead and jump in. All right, our first question says, the nurse is caring for assigned clients. The nurse should first assess the client who has option 1, decreased bowel sounds and reports yellowish green emesis. Option 2, jaundice and the sclera. Jaundice of the sclera and reports a moderate level of anxiety. Option 3, abdominal cramping and reports 3 black stools in the past 24 hours. Option 4, an elevated lipase level and reports upper abdominal pain rated as 9 on a scale of 0 to 10. All right, so I have the timer going. Y'all have 30 seconds. Let us know what you think the right answer is in the chat, and we will go from there. And hello, everyone. We have people from all around the world joining us. That's so amazing. As we always say on these too, keep track of how you do on these questions. We want to know at the end how you did out of 10. We're going to have... we're doing 10 questions, so just keep track. Seeing a lot of answers come in on YouTube and Instagram. Good job, you guys. Let us know what you think the right answer is. Good job, Nellie. I see a good answer coming in there. Good work, you guys. Good job, Keynes. Awesome. Good work. Okay, let's see. We have about 10 more seconds. Let us know what you got. Good work, everybody. A bunch of great answers. Good job to everyone on TikTok, and thanks for sharing our session. All right, let me pull up the answer. The correct answer is option 3. So option 3, again, this question is a priority question. We've done several of these, but when you see that word first and you see it bolded, it's bolded for a reason. So think about most important, think about your ABCs. This is going to be a C, circulation. We're worried about, this client has a GI bleed, so we're worried about hemorrhage, hypovolemia, things like that. And then look for what's expected versus what might be a complication. So what we see in, I know a lot of you guys put option 4 as your right answer. What we see there are expected findings of pancreatitis. So again, that's what we would expect to see, a lot of pain, but we don't expect to see a GI bleed with abdominal cramping. That's going to alert us that there's something more serious going on. So again, we can have, for GI bleeds, we can have upper GI bleeds, lower GI bleeds. Think about like esophageal varices, peptic ulcer disease, but findings associated with these are going to be dark stools, dark tarry stools like melena, and this is because of the release of iron in our blood, and as it passes through our GI system, it's going to change in color. So that is our correct answer. You guys did really good. I saw a lot of great answers come in, so well done. Okay, that was the one. Let's move on to number 2. Again, we're here doing GI questions, so we're on question 2 of 10. Make sure you guys engage in the chat with us. We're here to help y'all. Okay, question 2 says, the nurse is talking with a client who has a colostomy. Which of the following statements by the client would require follow-up? Option 1, I should avoid drinking coffee and alcoholic beverages. Option 2, I need to chew my food completely before swallowing. Option 3, I can continue to swim in the pool every morning. Option 4, I will wait to empty the pouch until it is full. All right, again, see those words, require follow-up. Let us know what you think. We've got 30 seconds on the clock. Good work, everybody. Awesome, awesome. A bunch of right answers coming through. Good job, everyone. A lot on Instagram today. We're glad y'all are here. Good work, everyone on YouTube. Good job, you guys. Good job, Toby. Awesome. Good work, you guys. All right, we have about 10 more seconds. Again, think about colostomies. Think about what the question is asking requires follow-up. So think about what that means. What is the answer going to be true or false? Hopefully that helps y'all. All right, good job. And as always, make sure you guys are following us. Share this video if you're on TikTok. We appreciate it. Okay. All right, let's pull up our right answer. Option 4, I will wait to empty the pouch until it is full. So again, it requires follow-up means that whatever the statement is, it's not safe for the client or it's incorrect. So that's the case with this. We'll talk a little bit about what a colostomy is. So a colostomy is like surgical diversion of the colon through an opening in the abdominal wall. So essentially taking our colon and letting it kind of exit our body. The stoma is the portion that is kind of attached to the abdominal wall, and this is where stool inflatus will pass. So the passage of stool inflatus from a stoma, it can't be controlled because there's no sphincter as it would be in our normal GI tract. So an ostomy bag is an appliance in a bag over where the stoma is, and it's what's going to contain the stool and the flatus. But you need to empty that bag when it's about 1/3 full to prevent spill and detachment and, everything associated with that. So think about skin breakdown. We also don't want the contents of the bag touching our skin. We want to get it emptied before that. So that's our correct answer, option 4. Good job, you guys. Way to go. A lot of you knew to empty it whenever it's 1/3 full. So good job, guys. Okay. Question 3. The nurse is planning care for a newly admitted client with diverticulitis. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, provide a high-fiber diet for the client. Option 2, administer IV antibiotics as prescribed. Option 3, request an order for a tap water enema for the client. Option 4, administer IV analgesics at regularly scheduled intervals. Option 5, monitor the client's bowel movements for the presence of blood. All right, I'll give y'all a little extra time on this one since it's a select all that apply. And let us know what you think. Again, select all that apply. It means you're going to have more than one right answer. We're talking about diverticulitis. Think about what that looks like. Is it infectious? Is it chronic? All that kind of stuff. All right, good work, you guys. I'm seeing a lot of good answers come in. Good work. Good job, Francis. Awesome answers. This one's a little bit tricky, so we can walk through this a little bit more. All right, good work, you guys. And thanks to everyone who's following us and sharing this session. We appreciate it. We're here for you. We want to help you guys as much as possible. And also let us know when you're taking your Nclex. We have our 7-day free trial available. There's tons of great questions on there. A lot of good NGN content, case studies, and NGN type items. So I can think of no better way to prepare for the Nclex than using our products. So we're just proud of what we do here. We hope it can help you the best it can. Okay. All right, let's pull up our answer. Options 2, 4, and 5. Okay, so I saw a lot of you guys selecting option 1, so I'll walk through this a little bit. What we want for diverticulitis is a low residue diet, so that doesn't always mean high fiber, but let's talk about what diverticulitis is. So diverticulitis occurs when the diverticula become inflamed or infected. This is often from trapped food particles or like little injuries to the wall of our diverticula. Interventions for this, it's going to be antibiotics. They're going to become infected and inflamed. We want to help process that infection. We also want to administer pain medicine. This is going to cause that inflammation in our intestines is going to cause a lot of abdominal pain. So we want to manage that. And we also want to monitor for the presence of blood. That can indicate any type of perforation or rupture. So again, we're looking for a low residue diet. And we're not going to do a tap water enema. That would be more of an intervention for constipation. So good job, you guys. Good work. A lot of good answers on here. Okay, question 4. Y'all are doing great. The nurse is caring for a client who has ascites and is scheduled for a paracentesis. Which of the following types of shock is the client at highest risk for developing following paracentesis? Option 1, neurogenic. Option 2, hemorrhagic. Option 3, anaphylactic. Option 4, hypovolemic. Good job, guys. Let's see what you got. Good work. You guys are doing awesome. Good job, good job. 30 seconds. Let's see what y'all got. Good work, everybody. A lot of good answers coming in. I'm seeing a lot on Instagram. Good work, everyone. Good job on TikTok. A lot of TikTok answers coming through. Good job on YouTube. It's going very fast. I'm trying to find a name, but I can't keep my eyes focused here. Good work, you guys. Awesome. Okay, we have about 5 more seconds and we'll pull up our answer. And also let us know what other topics you like to hear before we're done for today. We want to make sure and provide you guys with the questions that you're most wondering about. So, all right, let's pull up our answer. So we are worried about hypovolemic shock when we're talking about ascites and paracentesis. So again, typically when you hear the word highest risk, it's going to mean they have the most risk factors for this, which we can kind of apply this like kind of tip or rule to this because our client has ascites and they're having a paracentesis. So kind of think about those two different, one's a disease process, one's a procedure, and combined, what is that going to look like? So paracentesis, again, it's a procedure that removes excess fluid from the peritoneal cavity. It's performed to relieve a lot of times like difficulty breathing or discomfort. A lot of disease processes that can cause ascites and require paracentesis, kind of think about some of those like oncological situations like tumors, cancer, things like that. Also think about our liver too. So the client is going to be at highest risk for hypovolemia, and a lot of this is just due to the fluid shift from that third space in our bloodstream. So we're most worried about hypovolemia following a paracentesis, especially if we're pulling off a high volume of fluid. So think about like something more than 5 liters, which is very common when we're doing paracentesis. So good job, you guys. Correct answer is going to be option 4. I think you guys really did pretty good on that one. I didn't see a lot of wrong answers, so well done, everybody. Okay, question 5, halfway mark. The nurse is teaching a client with chronic pancreatitis. Which of the following information should the nurse include? Select all that apply. Option 1, supplement your diet with fat-soluble vitamins daily. Option 2, limit your consumption of alcohol to 1 to 2 beverages per week. Option 3, consider participating in a smoking cessation program. Option 4, take pancreatic enzymes with every meal. Option 5, consume a low-fat diet. Let us know what you think. Again, select all that apply. Think about what that means. Think about pancreatitis. Do we want true statements, false statements? Let us know. 30 seconds on the clock. Let's see what y'all got. Good job, everybody. You guys are, oh, good job, Bridget. Well done. This is also a tricky one. We got a lot of options to pick from, a lot to think about. Good job on TikTok. You guys did great. Good work. Let us know too after we pull up the answer how y'all did on the halfway mark, what your score is. All right, we have about 15 more seconds. Let's see some more right answers come through. But good job, you guys. Awesome. Good work, good work. Good job, James and Rosalind. Good answers, you guys. Okay, let's pull up our right answers. Okay, so our correct answers are going to be 1, 3, 4, and 5. Okay, so let's talk about pancreatitis. So chronic pancreatitis is an inflammatory condition. It's going to cause the tissue of the pancreas to become fibrotic, so hardened. It's going to impair pancreatic function. So think about insulin, glucagon, digestive enzyme production. So chronic pancreatitis is most commonly caused by chronic alcohol use. So that's why we're not going to pick option 2. We don't want to limit to a certain amount. We want to eliminate alcohol completely. We don't want any alcohol in our for our client. So again, commonly caused by chronic alcohol use. It can also happen from biliary tract disease, autoimmune diseases, tumors, cystic fibrosis, things like that. So clients with chronic pancreatitis, they cannot secrete lipase. So that is what we use to digest fats and require, these clients are going to require oral supplementation of pancreatic enzymes or lipase. So clients are going to need to take these enzymes with meals and snacks, and they're going to need to restrict dietary fat intake. But we also need to, I know you guys are probably wondering about option 1, because there's going to be a limitation on what our body is able to absorb. We need to supplement our diet with fat-soluble vitamins. So essentially, what our body is not able to absorb from the fat, we need to supplement with vitamins so that those kind of essential vitamins can be absorbed into our system. So good work, you guys. Awesome job. Okay, Let's see. Next question, question 6. We're on the downhill slope. Hope y'all are doing good. Okay, the question says, the nurse is caring for assigned clients. The nurse should first assess the client with option 1, cholecystitis, who has a rigid abdomen. Option 2, bowel obstruction, who has faint bowel sounds. Option 3, cirrhosis, who is reporting amber-colored urine. Option 4, peptic ulcer disease, who is reporting epigastric pain. All right, 30 seconds on the clock. Let us know what you think. How's everybody doing? Good job, everybody. Let's see what you got. Good job. A bunch of answers coming in now. Good job, Mary. Good work, you guys. Awesome. You guys are doing great. A bunch of people joining us from all different channels today. As always, we'll have this available on demand on Facebook and YouTube, so you can always check it out. Go back and practice these questions again. You can even turn your volume off and just skim through them, or put me on like triple time and go really fast and get your answers. So hope that helps. Okay, you guys are doing great. About 10 more seconds. Good work, you guys. A bunch of great answers coming in. Good job to everyone on TikTok. Again, it's not too late to share this session. Make sure you guys are following us too. We appreciate a lot of great content, and also check out our website. There's a ton of good information on there for y'all too about testing, what to know for the Nclex, how to prepare, and of course our question bank. So check it out. All right. Good job, you guys. All right, I'll pull up our answer. So our correct answer is going to be option 1. Again, we see this first bolded. It's bolded for a reason. Think about that big priority, what that big complication means. Think about ABC. So again, we're worried about our C, circulation. This is going to indicate perforation, which can be life-threatening, can be fatal. And then also look for options that are going to be expected versus complications. Perforation is obviously a huge complication of cholecystitis, or of a rupture of our gallbladder. A lot of these also are expected findings of, or are more expected to be seen with these disease processes. So you guys really did really well on this one. But again, let's talk about cholecystitis. So this can be caused by gallstones or biliary obstruction, and it's going to block bile secretion. It's going to cause our gallbladder to distend or enlarge. Excessively retained bile can irritate or weaken our gallbladder wall, which can lead to like gangrene and gallbladder perforation, and that in turn can cause peritonitis. So think about like life-threatening infection. Think about sepsis. So that's why this is going to be our priority. So good job, you guys. You did great. All right. Question 7, the nurse is observing a staff member caring for a client with gastroesophageal reflux disease, or Gerd. The nurse should intervene if the staff member is observed. Option 1, requesting a low-fat diet for the client. Option 2, encouraging the client to eat small, frequent meals. Option 3, placing the client in the supine position after the client eats breakfast. Option 4, administering a proton pump inhibitor to the client 30 minutes before dinner. All right, let's see what y'all think. 30 seconds on the clock. Drop your answer in the chat. Good work, you guys. A bunch of right answers coming in. You guys definitely know your positioning and what happens with Gerd and just the general laws of physics. So good work, everybody. All right, good job, everyone on YouTube and Facebook. A bunch of people coming in today from Instagram. We're glad to have y'all here. And let's see, wait for our TikTokers to come through. Good job, you guys. Awesome. Good job. Okay, let's pull up our answer. So the correct answer is option 3, placing the client in the supine position after the client eats breakfast. Okay, so Gerd, let's talk about what this looks like. We see here intervene. So intervene means whatever's happening is not correct or it's not safe for the client. So in this option, Gerd, we know that we don't want our client to be supine. We want them to be elevated. So what happens with Gerd is we have a chronic reflux of stomach contents into the esophagus. It's going to cause a lot of irritation. So usually our lower esophageal sphincter, in normally prevents this content from our stomach from going into the esophagus, but with GERD we have a malfunction. So anything that is going to affect the tone of that sphincter or increase gastric pressure or delay gastric emptying, all those are going to be factors that can precipitate GERD. So for this option, we want to make sure that the clients, they're not laying flat. We want to elevate the head of the bed. We want to allow the gravity to take hold and allow the contents that we just ate to make their way through the stomach. So laying flat kind of makes it more challenging for gastric emptying to happen. So good job on that. You guys did great. Okay, let's move on. Question 8 in the home stretch. The nurse is reviewing the food diary of a client with irritable bowel syndrome. Which of the following food items should the nurse recommend eliminating from the client's diet? Select all that apply. Option 1, rice. Option 2, oatmeal. Option 3, cauliflower. Option 4, apple juice. Option 5, sweet potato. What do you guys know about this? And a bonus point, let us know what type of diet somebody with IBS should follow. Let's see what y'all know. Let's see. Good job, you guys. Let's see what you got. Good work, good work. Good job, you guys. A lot of good answers coming in. Good work. Awesome. This one's tricky. Also, select all that apply. See, we have about 15 seconds left. Let's see what y'all think. I'm waiting for some more right answers to come through. Good job, you guys. Awesome. Good job. Good answers. Good work on Instagram today, too. Good job, you guys. All right, let's see what we got. I will pull up our right answers. So we are looking for options 3 and 4. Okay, so IBS is a chronic bowel condition characterized by like abdominal discomfort, diarrhea, constipation. So we don't have an exact like link of cause to IBS, but there's a lot of factors that can kind of contribute to it. So think about environmental factors, psychological factors, genetic components, things like that. So IBS is typically diagnosed by ruling out other GI disorders like food allergies, intestinal parasites, things like that. But what clients with IBS should restrict gas-producing foods. So think about that's cauliflower, definitely cauliflower, and also foods that might irritate the intestinal tract. So think about that's where kind of juice comes in, things really high in sugars. So the diet that clients with IBS want to follow is called FODMAP. So they should consume foods that are low in fermentable oligo, di, and monosaccharides and polyols. I'm not sure I said all of that right, but just know FODMAP. But so option 1, 2, and 5, those are all safe for our clients with IBS. Those are low FODMAP foods. Options 3 and 4 are high FODMAP foods. So good job, you guys. Okay. Question 9. That one was hard. Yes, that was a little tricky. I would say those diet questions are always hard. It's always good. You can do a little refresher on kind of foods that are high in different things. And one of the things that's great about UWorld is we have a ton of diet questions. We have tables that are going to help you remember what foods go with what. So make sure and check it out. Okay. Question 9. The nurse has taught a client with peptic ulcer disease who has a new prescription for omeprazole. Which of the following statements by the client would require follow-up? Option 1, I should take the medication daily after eating breakfast. Option 2, I will notify my healthcare provider if I experience diarrhea. Option 3, I may take the medication at the same time as my antacid. Option 4, I should take acetaminophen instead of ibuprofen if I am experiencing pain. Again, requires follow-up. Think about what that means. 30 seconds on the clock. Let us know what y'all got. And we are in the home stretch, this question and one more. We hope this was helpful for your GI questions this week. And before we're done, let us know what other content, what other question drills you want to see or what other content you have questions on. All right, let's see what we got. Good job, everyone. Good job, Victor. Good work. And Bonnie, good work, everyone, on YouTube and Facebook. Good job, everyone, on TikTok. And thanks to everyone who shared our session today. As always, make sure and follow us. We have all of our schedule of lives available to you guys. You can see what time we're on, the topics we're covering, what channels we're on. So we're trying to reach as many of you as possible. So make sure and check that out. All right, I'll give you about 5 more seconds. Good job. Good job, Sheila, on YouTube. Good answers coming in, you guys. Awesome. Good work. Good job. Okay. All right, our correct answer is option 1. So requires follow-up means the statement is not safe for the client or it's incorrect understanding. So omeprazole is a PPI. It's used to treat conditions like Gerd, peptic ulcer disease, H. pylori, and other conditions that are hypersecreting stomach acid. So PPIs reduce gastric acid secretion, and that's going to decrease the accumulation of acid in our stomach. So it's that's what we're gonna take these for things like stomach ulcers, things like that. So what the client needs to know is to take this for the medication to be effective, to help it reduce our stomach acid production. We need to take it before the meal. We don't want to take it with food. We want to take it before so that it can prevent that acid secretion once our food has been consumed. So the correct answer is option 1. Good job, you guys. All right, so we want to take it. Again, this is tricky. When we say require follow-up, the correct answer is going to be the incorrect statement. So that's always, maybe a helpful tip to kind of take with you when you take your Nclex, but always read that question carefully and reread it if it kind of trips you up a little bit. And then just take a, good true-false approach to it. Okay. Last question, question 10. Also, let us know how you guys did out of these 10 questions. We would love to know. Okay, the nurse is caring for a client with constipation. Which of the following snacks would be appropriate to offer the client? Option 1, graham crackers with peanut butter. Option 2, bran cereal with raspberries. Option 3, bagel with cream cheese. Option 4, yogurt with honey. All right, 30 seconds. Let us know what you think. And this is our last question today for GI questions. We hope this was helpful. Good job, you guys. Awesome, awesome. Good work. Let's see what y'all think. Again, think about constipation. Think about that patho, what's happening in our body. What is going to help relieve that constipation? Good job. Awesome. All right, I'll give y'all about 10 more seconds. Make sure you put your answer in the chat. And as soon as we have this answer up, let us know how you guys did out of the 10 questions. I want to see if anybody had a perfect score. Very good, you guys. All right. All right, so our correct answer is option 2, bran cereal with raspberries. So again, when we're seeing these food options, make sure that everything in the option choice is appropriate for the condition. So all of these options have 2 food choices, so make sure both of them kind of check the box for what you're looking for. So in this case with constipation, we're looking for high fiber foods, so that would definitely be bran and also fruit. So those are going to help with our constipation. All right, you guys, you did great. Let us know how you did. Awesome job. I'm seeing some 8.5s out of 10. I like the partial scoring for your status, so well done, everybody. But good job, you guys. We appreciate you guys being here. As always, we encourage you guys to go check out nursing.uworld.com. We have our free 7-day trial. You'll have a great taste for all of what UWorld's about. We'll have case studies, questions. We have lecture videos, NGN items, a bunch of stuff for you guys to take advantage of. We hope it can be helpful for you guys, and we are hoping that you guys are all taking your Nclex soon and passing. And please come back and tell us when you pass. We'd love to know it and love to know that you guys use UWorld to kind of as part of your Nclex journey. So we appreciate y'all being here. We look forward to seeing y'all next week on Tuesday. And come back and join us, follow us, all the good things. So thanks again, and we'll see you next time. Bye, everyone.